Hi guys, this is me Hannah. Welcome to my channel and to my very first video where I am gonna give you 10 useful tips for newborn baby care for new parents. So if you're interested, please keep watching. So before we get started, I just want to give a small disclaimer that I am not a professional, neither am I an expert, but just a mother with experience. Okay, now that being said and out of the way, let's get started. Now my tip number 1 is sanitize. This absolutely goes without saying. We know that we need to sanitize our hands, keep our hands clean, especially during this ongoing pandemic. You know, what my husband used to do was whenever he used to come out from outside, he wouldn't touch the baby at all. He would just go and shower up straight and, put on fresh clothes, and that is only when he would come near the baby. So my extra tip would be to keep spare vials of sanitizers in different places that are accessible to you when you're with the baby. Like it could be the dash of your car, your purse, the baby's diaper bag. It's kind of handy when you have sanitizers, at these places. So yeah, keep your hands clean and your baby free from infection. Now tip number 2 is to swaddle that baby. How many times have you actually noticed the baby, getting startled while they're sleeping? Many times, right? Now this particularly happens when they're flailing their hands and legs sometimes when they're not swaddled. Now even though the startling reflex is absolutely normal, it's best that it doesn't happen because it kind of wakes them up midway and it disturbs their sleep. So the best way to avoid this is to swaddle the baby. They also feel comforted and secure and snug, and they sleep for longer hours. One thing to make sure is do not swaddle the baby too hot, because especially if you're in a hot country, a warm place, you don't want to layer up the baby too much. The agenda is to keep the baby warm and not hot. So 1 or 2 layers is enough. My tip number 3 is to pre-burp. Now yes, this is not heard of. Even I had not known about it, with my first. But when I had my second, I learned about this thing that, getting the burp out of the baby before feeding the baby kind of helps. It helps in getting the extra air in them out, and then, they feed better. I've noticed that. When there's no discomfort, they feed better. Now, a little hack that I will give you about burping the babies is I particularly did not burp the baby in the standard way by putting the baby on my shoulder upright. What I did was I would put the baby on my lap and facing downwards, with the head resting in the curve of my hand, and the baby's back would be bent forward and the baby's legs would be like dangling down. Now that way I could expel the air by tapping slowly. I will actually try to insert a clip on the side where you can see this happening, and I'll also try to link it down below in the description box for you to see. So pre-burping the baby is as beneficial as burping afterwards. My tip number 4 is to keep a saline spray handy. So when we get a stuffy nose, we can easily blow out, right? But can the babies do it? No. Sometimes babies don't feed well when the nose is stuffy and they find it difficult to breathe. So clearing the passage out is a very good idea, and they feed better. Now this one I learned with experience. With my first one, I would see that he wouldn't feed well because of stuffy nose. Try to use a nasal aspirator by sucking out the boogers out. But if the baby doesn't let you do it and kind of moves too much, then the nasal spray, that is the saline spray, comes handy. Just spray it whatever is recommended, the dose, and the mucus kind of gets softened, and you can then remove it with the help of the nasal aspirator, or else you can just let it be. It just gets washed up and the baby is free. A baby, when can breathe well, feeds well, and a well-fed baby is a happy baby. Number 5 is cord care. So basically dipping cotton balls in warm water and cleaning the area around it is a pretty good idea, but my pediatrician suggested that I could use alcohol swabs as well, and that kind of worked too. Remember not to wet and touch the cord, because you really don't want to do that. Just let it dry off naturally and then it will fall off. I particularly preferred sponge bathing the baby. It really helped in drying up the cord faster, and it was gone within about 8 to 10 days. That being said, one more tip I want to give you is you can fold the diaper top inwards and then put the tabs on so that you don't disturb the cord at all. And even when you're making the baby wear pajamas, then twist and turn the top of the pajama, the elastic of the pajama, underneath the cord. That way it will be free from any friction. Now my tip number 6 is to check for the yellowness. Now, some babies are prone to developing mild jaundice after birth. Now this is a medical area, so I don't want to say really a lot about it, but what I did is what I'll say. I experienced this with my first baby, and what we did was take him straight to the hospital and we gave him phototherapy and such, but that can totally be avoided if it is mild. What you have to do is just give sunlight therapy. That is the best thing. Our elders, swear by it. It's basically a grandmother's hack. You just have to expose the baby to the morning sunlight, somewhere between 7 and 10 a.m., not the harsh sunlight, just the mild one. You can even have your baby, sit in front of a window where there's sunlight pouring in, and that works as well. You just have to expose the baby to sunlight for about 5 to 10 minutes, or maybe 10 minutes every day for about a week or 10 days, and that absolutely works. You can see the yellowness in the eyes disappearing. This is basically the safest and the painless way of getting rid of this mild yellowness in their eye. So if you want to do it, then do this and try this at home, or else you can consult the doctor anyway. Now it's time for tip number 7, and that is to check for dehydration. So basically, when the baby is not drinking formula milk, it's hard to tell if the baby is having enough or not. But if you see that there's a dry diaper for about 3 to 4 hours, and this is happening more frequently, it means that there's less water in them, and obviously hence less output. Keep a check for parched mouths and dry diapers. That's what you need to see. I particularly faced this, and my baby wasn't really having a lot of milk, and I had to go and see the doctors. So I'd just say be aware and act wisely. Now it's time for my tip number 8, and that is night care. Safe to say that we have to say goodbye to those long hours of undisturbed sleep, because obviously we have to get to the baby even during the night. Their tiny little stomachs can hold only this much amount of milk, and they actually have to be fed every 2 to 3 hours. Now, my pediatrician said even if the baby is sleeping, wake the baby up to feed. Try to tickle their feet to gain their attention, or tap slightly on their cheeks. That way you gain the attention and you can do your thing. Now, when you want to put the baby back to sleep, what you want to do is check for a soiled diaper, because you never know if the baby has, pooped while, in sleep. I don't know if that happens. But anyway, if that has happened, then you don't want the baby to develop a rash overnight. Now, my tip number 9 is to sync your sleep cycle with the baby. How many times have we all heard about this? Sleep when the baby sleeps. It's actually as simple as that. We have to take care of ourselves too. Taking care of the baby takes effort, and for that we need to take care of ourselves. And postpartum care is actually a real thing. Most of us, when the baby goes to sleep, think, okay, fine, the baby has slept, I should better, complete the errands at hand. Take help, whatever help that is being offered to you. Ask for it shamelessly if you can. Your husband will help you, any elders if they're around, friends, neighbors, anybody really, and just prioritize your rest. When the baby sleeps, try to sleep with the baby. My final and 10th tip is to make eye contact and cuddle away. I can't say this enough. Just try to make as much eye contact with the babies as possible. So don't worry if you see their eyeballs drifting in opposite directions. It's called being wall-eyed. It's absolutely normal. The doctors say it's really nothing to worry about. Just talk, engage, and make them feel your presence. Come at this distance and make eye contact with them, because it's said that they can focus really only at an arm's length. Till an arm's length, and you don't want to miss out on that. Just love them and cherish them, because it's only a matter of time that they grow out of your lap and are out and about. And I hope you found this helpful. If you did, then please give it a like. Also share it with someone who is about to become a new parent. Also, if you think I've missed anything out, obviously, which I might have, please write them in the comment section below so that people who are watching this can benefit. Well, thanks a lot for watching. Until we meet again, I hope you stay safe. Bye.